Dolores White, and I have the pleasure of serving as president for the KNA. And we'll go through everybody because we definitely want everybody to introduce yourself, but we're going to do it by boards and cabinets and committees. So we will get everybody introduced within the first, 15 minutes or so. But I just want you to know who I am since I'm facilitating here. Delano, can you introduce yourself to why you bring up PowerPoint?
I can. And I'm Delano Manson. I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. And I've been around I just had my anniversary. So I've been around 6 years.
Isn't that wonderful? A lot of great work in 6 years. And again, I know we'll go through all the members shortly, but I'd like to make sure that Kim introduces herself too, since she's here.
Hi, everyone. Thank you all for being here. And especially thank you to the students for being here because you're going to learn a lot. Thank you to all of our new leadership. We appreciate you and know you will learn lots from the current leadership, who also thank you all for being here because you all are great as well. And I'm Kim Becker. I'm the Associate Administrator for the Kentucky Nurses Association. And Delano likes to call me her mini-me, but those are really big shoes to fill. So we're not going to go that far. So
first thing we always do is a moment for mission. That's how we start everything we do. And Donna Metter, our immediate past president, she's going to explain why we do that and provide the moment for mission today. So Donna?
Okay, can you guys hear me?
We can.
Okay, good. Good. You know how sometimes when you do the audio on your phone, your mute button that comes up on your phone is not really what you have to do. You have to do the *6 or whatever. So I am doing audio on my phone because my internet, as usual, is unstable, but that hopefully will change. So thank you, Dolores and Delano. I'm going to share the moment for mission now. So for the last several years, KNA, KNF, and KNAC have been starting each meeting with a moment for mission. The moment for mission is a short part of the beginning of the meeting where one of the members shares something that kind of brings us back to why we're here, our love and passion for nursing, for humankind. Some folks call it a reflection. So it's kind of something along those lines, and it can be short or it can be a little bit longer. Sometimes the moment for mission is assigned in advance, and other times we just ask if anyone has something to share for a moment for mission. Our reflections have been anything from videos to personal stories, poems. We even have had guided meditation. Thank you, Leanne. So if you are asked to provide a moment for mission, it doesn't have to be anything super formal. It can be as simple as something that recently happened in your life that made you proud to be a nurse or kind of made you think about your nursing career. So I have been asked, as they said, to share tonight's moment for mission. So when I was thinking about putting about this meeting and the election nominations and elections committee, putting the ballot together for our election, and I was thinking about this meeting tonight, I really was thinking about having opportunities to serve and lead. I found a couple of quotes that I thought were relevant to this. And the first one is from financial guru Warren Buffett, who I'm sure you're probably familiar with. And that is that someone's sitting in the shade today because someone planted a tree a long time ago. A lot that we do, you'll find in these cabinets, committees, and board meetings takes some patience, some time, and almost kind of like some watering, of the plants that we have planted for us to be able to see the fruits of our labor, but it is well worth it. The other quote that I thought was really neat and helpful is from a gentleman named Benjamin Franklin Fairless. He was a U.S. steel executive who was born in 1890 and he died in 1962. So, he's from a previous era. Along with being a steel industry executive, he was well known in his time to be a humanitarian. And interestingly, he came from a very, very poor background, but he worked his way through college and he worked as an assistant in a psychiatric hospital to help with tuition. And his quote is, "What is the recipe for successful achievement? To my mind, there are just 4 essential ingredients. Choose a career you love, give it the best there is in you, seize your opportunities, and be a member of the team. So I want to thank all of you for seizing this opportunity to lead and to serve the 90,000 nurses in our state. Between all of our boards, cabinets, and committees, we cover the gamut. We really cover a huge range of areas that need to be addressed for the nurses in our state and along the way for our patients, our communities. Workforce ethics, education, event planning, advocacy, and much, much more. And it's all in the name of really promoting our profession and furthering our profession. So thanks again, and I hope you enjoy the work that you will be doing so much on these cabinets, committees, and boards that it doesn't feel like work at all. And if you look when Dolores is speaking, and you can kind of see her and on her wall in the back, it says "Love what you do," and so that's how I will just kind of wrap up this moment for mission. Is that I hope that with everything that you're doing with KNA, it just adds to that loving what you do.
Thank you, Donna. That was a perfect moment for mission. And speaking of the wall back there, that's my positivity wall. I need positivity in my life. So that's right there. Feel free to share. I'll share my positivity with you. Okay, so you saw the agenda there. Thank you, Kim, for getting the PowerPoint up. We're going to start with introductions, and then we will work our way through just some, little tidbits to help you have some information to get started with the KNA. So with introductions, we have 3 boards, as Delanor mentioned, KNAC and KNF and KNA. And we'll go ahead and start with KNF. And Linda is here tonight. Linda Thomas, would you like to go ahead and start with KNF?
I will. Can everybody hear me?
You
Yes.
can.
Okay. Well, Kentucky Nurse Foundation, I think I would say we're probably the philanthropic arm of the Kentucky Nurses Association. We're a 501c3 status foundation, and we have kind of a contractual and a professional relationship with KNA. We enhance the achievement of their strategic goals of theirs as well as ours, and we support the mission of KNA. We are here to advance and expand nursing practice. And we focus on clinicians, educators, leaders, researchers, healthcare policymakers, and most of all students to promote the highest level of health and well-being for all nurses, as well as the citizens of Kentucky. Now, we take in money in relation to grants. We also have the Honor a Nurse, Remember a Nurse, where people can actually donate money in honor of or in memory of a special nurse in their life, or a student for that matter, I would guess. We also have Nightingale Tributes, and that's where at the funeral of a nurse, no matter if they were a KNA member or not, we do honor them. We also present scholarships on a yearly basis, and our goal is to begin again providing grants for research. You also can give to KNF by the Kroger card. I wanted to remember to mention that as well. And there are currently 12 members. We have a chair, vice chair, secretary, treasurer, and we have nurses as well as non-nurses. We have some wonderful citizen members that are doing great things both on the foundation and with KNA. And we meet quarterly, and we have committee work, and that's between the meetings of those quarterly time. So it's a great opportunity to look at students. It's a great opportunity to assist KNA, and it's a wonderfully working board, of which Delanor kind of gives us a charge, and we try to handle it.
Hey, thank you, Linda. That was a beautiful rundown of work of the KNF.
Oh, I'm sorry. I also have one more thing. I'm supposed to talk about the online raffle, and it began September the 9th, and it's going to end November 13th at 7 p.m. Eastern Time. And the raffle is $20 ticket. You can buy any number of tickets. It did not tell me how much we are, how high we are in our raffle right now. And Eleanor, can you give me that number?
We are around $600
Okay.
on our split a pot. But I know that everybody on here is going to buy at least one ticket.
At
least one ticket. And I can say we don't have actually we do have the two winners. Last year, no, it wasn't last year, but Jody Rogers won 1 year, and Teresa Huber won 1 year, and Donna Metter sold the winning ticket another year to a lady at her church. So, and everyone has won at least $1,000. So I want to encourage you all to buy at least one ticket, and just remember, it is for scholarship and research. And so we and the KNF, as Linda said, we raise money to give it away. And you know what's right?
Yes,
with that?
we do.
Everything.
That's it.
Perfect. Thank you, Linda. Is there anything else
Thank
you'd like to share?
I think that's it. I appreciate having the opportunity to do this.
We appreciate you. Thank you. Okay, the next board is KNAC, the Kentucky Nurses Action Coalition, and I'm looking over here at our participants. I don't know that I see Julie. I do see Marcia. Is Julie on? Am I missing her?
Julie is in her car, and she has not been able to get in from her car. But that Marcia could do the do.
That's what I was saying. Marcia's on. Marcia.
I am. Hello, everybody, and good evening. It's so great to see all your faces this evening. I am Marcia Woodall, and I am president-elect for Kentucky Nurses Action Coalition, and you'll hear us say KNAC. That's the acronym for it. But our organization is part of KNA. And we look at different issues around the state, such as workforce, the Barn Initiative for educating. So different things like that you're going to hear about. We were instrumental in the nurse suicide, working with KBN with nurse suicide regulation and getting that education out there and various things like that. So more to come, more exciting things to come. And I hope you all consider becoming a member of KNAC as well, because we definitely work side by side, but we have a little varied agendas. So thank you.
Thank you. Thank you, Marcia. You're right. We collaborate very well, and KNAC is part of KNA. So I'll introduce for KNA, which is basically the overarching umbrella for KNAC and KNAC. KNAC and KNF, as well as all of the committees and cabinets and all of the great work that's done statewide with all of our volunteers and staff. And all of that is through governance and collaboration and just beautiful work to meet our strategic plan, our mission, vision, values. We make it happen every day for the nursing profession. Donna's moment for mission was perfect because that's what we strive for, right? And that's what we do every day. And we're so glad to have all of you newly elected nurse leaders as well. So for KNA, we have a few newly elected members that we'd like to introduce. And some are returning. So the first one on my list is Jody Rogers as vice president. And he is returning in the role. So Jody, will you introduce yourself?
Hey everyone, I'm an everyday nurse named Jody Rogers. I'm currently serving on my 4th consecutive term on the KNA Board of Directors. I'm a proud Navy veteran of the Navy Nurse Corps. Hoorah. I'm a husband, I'm a father, I'm an Iron Man. In my daily life, I'm a president of an organization called the Kids Club. And so I'm just really happy to meet you all, and I hope I get a chance to work with each one of you.
Wonderful. Thank you, Jody. Okay, and then next is our new board of directors secretary, Cody Ryan. Yes, I see Cody's name in the participants. Cody, will you unmute and introduce yourself?
Yeah, most definitely. My name's Cody Ryan. I am new to this role. This is my first term serving in this role. I've been a nurse since 2015. I have connections to the KNA through some of the faculty and my mentors at Bellarmine University. So they've been great in terms of, guiding me and providing me some great leadership experiences throughout my, trials as a nurse. Like I said, I've been a nurse since 2015. I've been faculty at Bellarmine since 2017. I'm now tenure track there. I still work and practice at University of Louisville Hospital. Currently, I'm a supervisor at U of L Peace Hospital. Psych is my primary specialty area that I work in. Let's see, I just finished my FNP in August. So happy that is over with. And I have a partner of 10 years, and that's pretty much my life in a nutshell. That's sad to say, but that's what takes up all my time. So happy to be in this role. I think it's going to be really fun, and I'm excited to work with all of you. So thanks a lot.
Sounds great, and welcome. Welcome. Okay, next on the list is Joanne Mattingly Ray, our new president-elect. Joanne, will you introduce yourself?
Good evening, everybody. I am so excited to be part of the KNA as president-elect. I have been involved with the KNA for many years. I have been a nurse for 31 years. I can't believe I'm saying that. And I've been in leadership for 25 of those years. And I am just really excited to be part of the KNA as your president-elect. I am so glad to have Dolores that's going to be my right hand. And then I've got Donna Metter on my left hand, and I've got Delanor pushing me from behind. So I think I'm going to be pretty good. I've got a great team, so I'm very excited.
Well, welcome, Joanne. We look forward to working with you. Okay, next on the list is Amy Fennell, who's elected as a director for the board of the KNA. Amy, I think I saw you.
Yeah, I'm on here. Hi, I'm Amy Fennell. I am super excited to be here. So I've only been with the KNA for 1 year. So, but I'm excited to get involved and get to see different things and kind of go take my nursing a little bit of a different direction. So I have my past, I've been at St. Elizabeth since 1989, kind of grew myself up there, been a nurse for 26 years. 12 of those years have been in a director role. Prior to that, I was in an assistant nurse manager role in the emergency department. So currently I have a lot of different pieces on my plate. So I have vascular access team, wound care, admission units, the Bed Placement Center for St. Elizabeth for the organization. So patient logistics, the ROC, which makes up all of the time card keepers, the staffing office, and then also our system-wide float pool. And then I also teach at Northern in the MSN program. Really enjoy doing that. So leave St. Elizabeth during the day, come home, and usually do that at night. So I have 4 grown kids, so they're gone, have grandkids. And when I got to do my recording, when we were doing that the last time, one of my sons was having a baby, so watching babies again today. So kind of going in a different direction with my life. So super excited to be here.
Well, we're happy to have you too. Thank you, Amy. All right, next is Donna. She has been elected into director at large position as well since her immediate past president role is ending. Donna, can you share a little bit about you?
Thank you, Dolores. So I have enjoyed the last several years working at the president-elect, president, and immediate past president level in those roles. And so I was really excited to think about being able to continue, but in a little bit less intensive capacity. So thank you guys for, I'm grateful that I was reelected or elected to the board of directors as a director at large. We have just really done so much in the last few years, and hopefully you're aware of the things that we've been able to accomplish at KNA in the last few years, KNA, KNF, and KNAC. But I'm really proud of that. And so I'm really excited to be able to continue the work that we're doing, because there's several things that are still in process that we need to kind of wrap up, and there's always going to be more work to do. So I am a nurse of 41 years, and I graduated from nursing school before I was even able to legally enter a bar. But so most of my career was hospital based, and then the last 8 years of my career I worked for the Kentucky Hospital Association as for a big patient safety and quality project, which is wonderful. It took me all across the state, working with many hospitals and organizations, and it was really great. So I retired from a full-time nursing position in September of 2019 and started working part-time in a human resources capacity, or actually full-time, in a family business after that, under duress, but it turned out fine. And now I'm part-time in that. And so it has allowed me to have a lot of time to devote to the work that our great organization has been doing. So I really am appreciative of having another role here, and looking forward to the next couple of years. Thank you.
Sounds good. Thank you, Donna. All right, so those 5 are our newly elected members of the KNA board. We have a couple of other board members here that are remaining in their positions, and I'll just tell you their names so you can look at them in the Brady Bunch just for ease of time. We also have Marsha Woodall. She had introduced herself just a moment ago for KNAC, but she currently serves as the secretary on the KNA board. Valencia Brown is a director on the board. Michael Rager is also a director. Necia Thornton is our chapter liaison to the board, and Kelly Savage is actually getting ready to come up for the ERC. So I looked through the list. I apologize if I missed anybody, but I believe those are our other board members here tonight. And so next on our list, we'll move to the Education and Research Cabinet. And Kelly, if you'd like to go.
My name is Kelly Selvage, and I'm the chair for the Education and Research Cabinet. I've been in the position for 3 years, so I'm actually outgoing. But hope that I've planted some seeds and watered some stuff for the new people that are coming in for the committee or the cabinet to continue to work on. But our cabinet focuses on education and research throughout KNA. The education piece really is around our learning management system and our different offerings, looking to see what potential topics our KNA membership are interested in, and finding ways to get that developed and into our LMS. And then on the research side, we do have a process that people who want to put out research to our KNA members can go through. We want to make sure that we are vetting any research that KNA would be publicizing for people to participate in. And so we take that very seriously because we know your time is important. And then we also are trying to merge those two and do some education about research and evidence-based practice to just try to bring it to the forefront of all of our nurses across the state, because all of our nurses are participating in evidence-based practice and research every day, including at the bedside, and just really getting awareness out there that that's what they're doing, and the importance of that research and evidence-based practice to our profession. So we're really excited to have 3 new members on our cabinet starting, and there will be lots of opportunities to engage and be really productive.
Okay, so the 3 new members for education and research, we'd like to welcome Annie Payne. Annie, where are you? I saw you. There you are. And then Leslie Brown. I saw her. Leslie, wave. Okay, and Ronnie Harold. Where are you, Ronnie? Ronnie. Oh, there she is. Okay, so those are the 3 new members for Education and Research Cabinet. Welcome.
Thank you. And thank you, Kelly. Okay, next on the list is Governmental Affairs Cabinet, and April was not able to be here today, so Delano is going to cover that one.
Actually, Teresa is going to cover that.
Who's
one.
Teresa gonna do it? You,
Thank
Teresa?
you, Teresa. Thank you, thank you. And you have on polka dots too. Oh my God, you can't get any better than that.
So I am Teresa Villaran. I am the Secretary of the Government Affairs Cabinet. And what the Government Affairs Cabinet does is it does several things. We set the legislative priorities for the KNA. We choose them, but the Board of Directors actually approves them. We work with the lobbyist to help legislators understand what our priorities are, what issues nurses are facing. And then we help members try to get also to their legislators. We work with the KNA to develop the program for the Nurses Day at the Capitol, which is going to be in February of next year. And then we also did our first legislative conference this year, and we look forward to continuing that next year, and it will be in May of next year. We also work with the Leadership and Legislative Academy. That's a great learning opportunity to either go into the legislative track or the leadership track. That will occur next November, and we hope to have 20 participants in that program. So we have a lot going on, and we hope that you will pay attention to what's going on in the next legislative session. We also have had this month town halls. Our next town hall will be next Thursday, not this Thursday, next Thursday, and then on October 4th. So look on the KNA website and register so that you can hear what our state legislators think about nursing and our issues. So I look forward. I don't know. I did not hear how many new members we have to our new cabinet, but Delnor will tell us.
Teamwork. Thank you, Teresa.
Thank you, Teresa. Also, did you mention about the Nurses Day at the Capitol is February the 8th, and we are in mid-season for doing our town halls. The one for this week had to be canceled because our legislators were not able to attend on this Thursday. And then the next one, which Teresa's chapter will be hosting for Bluegrass, will be on September the 28th. Am I saying that right, Teresa? Okay. And so we hope that you will register to attend. So for new members for the GA cabinet, we want to say welcome to Cynthia Hetty. And I don't think that she is with us at this time, but she is in a staff nurse position. And then we have Ben Hughes and Linda Robinson, and Casey Bryant is returning, and Ben is also returning. So welcome again for Ben and Casey. Linda will be new and Cynthia will be new as well.
Thank you. And welcome everybody. Next is the Professional Nursing and Advocacy Cabinet. And Sherry Kretschmer is the chair, but I don't believe she has been able to join. So Delnor is ready for that one. Yeah.
Yes, I'm the stand-in for everyone unless we have a Teresa Villaran, and then I don't have to stand. It's wonderful. So the Professional Nursing and Advocacy Professional Nursing and Advocacy Cabinet is a cabinet that really focuses on professional issues. In fact, they've been even sending people to the Board of Nursing meetings, and they've also been focused on social justice, and they've been responsible for the social justice movement. And I want to give a shout out to Teresa Villaran, because when she was the chair for the Professional Nursing Practice and Advocacy Cabinet, she actually started that series. And it was a series that we thought was going to be a lost leader, but it turned out to be something that was just incredible, and we've been able to continue moving forward. So we are doing a series this this fiscal year, that is focusing on violence prevention. We just did one on August the 24th that focused on gun violence, and the next one is in November. And is it November? November? It is in November, and it is focused on preventing harm to self through violence. And so we're looking at suicide prevention for that one. So we encourage you to sign up to attend these. They're normally $20 per person, and it is for usually 1 or 1.5 seating, where we watch a movie and then we have an expert panel discuss the movie and other things that would be related to that. So for the Professional Nursing Practice and Advocacy Cabinet, our new people are Professional Nursing Practice and Advocacy. 1 second. Okay, here we go. We have Kim Dempsey Reed, Yolanda Stout, and Eunice Taylor. Those are our new members for the Professional Nursing Practice and Advocacy Cabinet. Welcome, welcome, welcome. And we are inviting everyone to attend the October meeting of your cabinet so that you will get a little bit of orientation and then actually take office in November.
Absolutely. Cabinets and committees. So and boards, everybody.
Everybody.
Yeah. Everybody who's new, please come in October. Thank you, Delanor. And then nominations and elections. I don't believe that Kristen has joined.
No,
So she has not. Okay, I can go ahead and do that one and give Delanor a little break. She's getting ready to round up again here in a moment. The nominations and elections, I mean, it's pretty much what the name is, right? They work throughout the year to encourage people to self-nominate and serve in a role. And those of you that are here in active roles, you know how that works because you have either submitted your application or have been reached out. And they work really hard to fill the ballot with phenomenal nurse leaders from across the state. And they also work really hard for diversity in all aspects, including geography, right? We want to be across the state. And so when you fill out your biographical form, you see that we do collect that data. And that is something that is in the strategic plan for the KNA, is to include diversity as much as possible in everything we do. So that is something that they have worked on. They had a great ballot this time. They oversee the election as well and stay in touch with Delanor and how we're doing with that. They were instrumental in getting our Election Buddy, our new software that we use that we feel has been very beneficial and user-friendly. And now they are getting ready to get started on next year's ballot already. So before you know it, they will be involved with that. They also assisted the GA cabinet with the Legislative and Leadership Academy as far as reviewing applications for fellows and working through that process of accepting fellows for that. And with the team that is coming forward, there's 4 new members of the committee, or excuse me, 4 newly elected. 3 of them are returning: Bard Snap, Vanessa Williams Harvey, Kathy Hager, and then there's 1 new member, Nicole, and I'm sorry if I say this wrong, Gilliam or Gwilliam. Welcome to all. Look forward to getting started to review the process of this past election and get started on the next one. And then next is Ethics and Human Rights. And I saw Joey on here. Joey, are you able to unmute and share a little bit about your committee?
Absolutely. Good evening. I'm Joey Burke. I am the hospital nurse ethicist for the University of Kentucky. I've been in that role for about 3 years. Prior to that, I was a bedside nurse for 20. So I joined the Ethics and Human Rights Committee a year ago and absolutely was amazed with the work that was being done. And so it was a really welcoming group of talented individuals. So I am absolutely thrilled to have returning members with our group. We have been working on initiatives to really put forward the code of ethics in nursing, and have published an article and are now working on some visual representation of the code of ethics. It's our current project. So really trying to set the code of ethics as really our rock, our anchor, our guide, to really remind nurses of the strength that they carry with them as nurses and in complex healthcare that is today's healthcare experience. So we're doing some amazing work, and I am so much in awe of the quote that Donna produced earlier about seizing the opportunity and building a team, because I really think our group has put together a team that has done some great work and just is genuinely a pleasure to work with. So it's great to hear the voices of experience across the Commonwealth. So I'd definitely like to welcome back Tracy Lettle-Hale, Joy Coles, and Karen Sharber. They really make my role a pleasure, and I absolutely couldn't do it without them. And then joining our team is David Coffey. So we look forward to doing some really good work together.
Wonderful. Thank you, Joey. And again, welcome to everyone. That we really look forward to working with you over this next term. All right. And then so Delanor is actually going to go over a few slides, and then I'll take over towards the end. So Delanor, go ahead.
Great. I just want to briefly show you our organizational structure. I want you to pay attention that membership is at the top. We cannot do anything without members. We have 2801 today. By the end of the month, I'm expecting us to have 2850. When I first started, Kathy, were we about 16 or 1800? And so we have grown exponentially. And so I say thank you to all of you. But now you get to be an opportunity to be an ambassador for 90,000 nurses and for the KNA. So get out there and talk to your colleagues. And if they're not KNA members that day, maybe the next day you can make sure that they are a KNA member. I also want to show you that with the Kentucky Nurses Action Coalition and the foundation, that they are part of the KNA enterprise. And so we do all of those things that you've heard about collaboratively, and we can't do what needs to be done for 90,000 nurses without the Kentucky Nurses Foundation and the Kentucky Nurses Action Coalition. We have 11 committees and cabinets. We have 7 committees total and 3 cabinets. And then we have 11 chapters all over the state, which I'm going to show you the map. I also would like to tell you that we have a very small staff that serves 90,000 nurses and serve you. If you have needs, if you have things that need to be done, I would say go to your chapter or cabinet chair or board chair first, and then have them to come to me if I can help you to get anything done. But I am your resource. You met Kim. We have Sherry Chandler. She's our membership manager. We just hired a new person that started today. She's our communication specialist. We also have a communication and administrative support. That is Debbie Belt, and then Vonda, who answers the phone and runs the office. And they are incredible. They are a wonderful, wonderful team. Nothing would be happening at the KNA without them, that's for sure. Next, what I'd like to do is talk a little bit about our website and how we communicate. On our website, we have 2 really important things. One of them is a magnifying glass, and it's for a search bar. So if you're thinking that you would like to find something on the website, use that magnifying glass and type in whatever it is you're looking for. The other thing is a bar that says search here. You can click that and a search bar will come up. So I encourage you to use that as well. Also, we have on the website many members only resources, meaning that if you're not a member, you don't get access. This is a benefit area. Talkify is an area where anybody in the community that wants us to support their activity can fill out a form, and then it will go on our website after we review to make sure that it is something that we want to make sure that has our name attached to it. Oh, next, this is what the Talkify looks like when it's on the website. And you can see it, it's kind of in the center of the homepage. And it's right near the map of Kentucky. So anybody that wants to promote something in our state can use Talkify. We pay for it, but we support our community in that way. Now, I want to talk about money. This is one of my favorite subjects, money. First of all, we do get money in. from dues. You pay about $15 a month for your dues. We get half of that. The rest of that goes to the ANA. And what they give us for that amount of money, which comes out to be about $20,000 a month, is they do our demographics, they collect our dues, they do collateral materials, they do some marketing for us, and they do lobbying in Congress for us. So they do a lot of really important things for us. We get grants. We had 3 grants last year, and it was wonderful. We have no grants at this time, except one grant that is dependent on if we get other grants. So if you know of grants that are out there that we might be able to apply for, please let us know. We just recently purchased our building, so we have a renter downstairs. So we have rental property income. We also have a CE provider program, and people pay us to approve their CEs, and then we provide them with the CE certificate. We do conferences, and that is another way for us to get money in, and sponsorships from the conference, and then other sponsorships like our publisher gives us some sponsorship money because they don't share any of the revenue from the advertisement. And then we have a new program, the Alliance program, which includes the partnership program where we will engage in arrangements with other organizations like UPS or banks or anybody that wants to have a relationship with nurses. And then, of course, we have our sponsorship for the conference. Now, let's talk a little bit about expenses, salaries. I mentioned about the people that work at the office. We have 2 full-time people. I'm not one of them. And then we have 4 part-time people. So we have about 4 FTEs total to provide that support. Our dues do not sustain our salaries. So that means we need a lot of non-dues revenue, which includes things like CEs, grants, conference attendance, conference registration. So we need to have a lot more income if we are going to be able to do the things we need to do for the 90,000 nurses. And one of those things is our lobbyist. Our lobbyist does an incredible job for us, but she costs money because she has to pay her mortgage, and she has kids that need shoes and things like that. So she won't work for free. I asked her, she will not work for free. Just like we don't want to work for free because we want to live in a house and have shoes to wear too. So what I'm saying is that we have a number of expenses. We also have growth funds that we give to the chapters. Every chapter, every one of the 11 chapters is eligible for $2,000 a year. That's $500 a quarter that they can spend to grow their membership. So that's automatically off the top. Every chapter is eligible for that $2,000 a year. Nurses Stay at the Capitol. It costs money for us to have Nurses Stay at the Capitol as well as our Leadership Academy. So those are some of our expenses. I mentioned earlier that we had 11 chapters, so you can see where they are located. Every place a nurse works, every place there's a county, there's a KNA chapter, and there's a KNA chapter leader. So hopefully, as leaders now for the KNA, you will make contact with your chapter and go to chapter meetings and share with them the things that you know about what's happening in the KNA. Because now, remember, you're an ambassador. Communication. This is my last slide, but this is one of my favorite slides because communication is so important to nursing and to the nursing profession. We have a website that is robust. And if you're looking for something, I would start with our website in that search bar that we talked about earlier. We have a contact directory that's on our KNA 365, but we also have a contact directory that we give out at our leadership retreat that has every leader's phone number, email address in the entire KNA. So that is something you will want to keep up with. Every month, we publish an e-news just for members, and it has members only information. For instance, it is now time, and the opportunity is with us, to apply for sitting on the KBN. That is only open to members. Other things like participating in the elections, that's only open to members. Those kinds of things are focused on in the e-news. We have a quarterly Kentucky Nurse. It is a award-winning Kentucky Nurse. We also have a special bulletin that we put out 8 times a year on the months that we don't put out the Kentucky Nurse, which goes out 4 times a year. We are very active on social media. And of course, we have Sherry Chandler Productions, who helps us with our social media on Facebook, X, Instagram, and LinkedIn. And last but not least, we have a KNA 365 app. Not many nursing associations in the entire country have an app like we do. So if you have not downloaded the KNA 365, you must do that so that you can stay connected through the website. You can get to the website. You can sign up for registration for classes. You can sign up for the conference. All these are all things that you can do with your phone on your KNA 365 app. You can even sign up for the Nurses Day at the Capitol. It is to your advantage, and of course ours, if you sign up and get the KNA 365 app. Oh, I can tell you how to do it real quick. So I'll go to the next one. The KNA 365, oh, all right, I didn't do that right. Okay, let me tell you how to do it. So all you have to do is go to your app store, whether it's an Android or an Apple, and you search KNA 365, no spaces. Then you click on that, download it, put in your email address, and voila, you have access to KNA 365. That's all you have to do. Okay.
It's pretty phenomenal. It's our little mini website. So much great information is on it. It's wonderful. Okay, I'm just going to wrap us up with a few activities and dates upcoming. The COVID testing continues. So we always need volunteers to help with that. We have a phenomenal team of nurse leaders, nurse volunteers, students, and others that are non-nurses that have been tremendous in providing testing and vaccine clinics since the start of the pandemic. And testing continues. So if you can assist with that, Delanor needs to know. Send her an email and she will put you to work. And then that, is that where you say the project? Is that what we're wanting to talk about, Delanor, with the moving out with the chapters?
Yes.
Is that going forward?
Well,
yeah, you want to talk about that?
Yeah, if we get the grant that we applied for, we will move out of Louisville and go to 6 different chapters and do the same things that we did in Louisville, including testing and vaccinations and listening sessions. So we have our fingers crossed that we are going to get this grant. And we're very excited because we have everything ready to go. All we need is a little funding to get out into the state and support the state, just like we were able to support primarily the River City chapter.
Absolutely. Thank you, Delanor. And then just a few dates here for you. So the business meeting is October 26th. Hopefully you can attend that. It's going to be virtual from 5 to 7. And it is where we do a year in review of all of the great work of the KNA, KNF, all the committees, cabinets, everybody. So we share that. It is also where awards will be presented, and we have that coming up on a couple of slides, so I'll cover that a little more then when it comes up. And we do a year in review of our Nightingale tributes, and it's really a great informational meeting. And also our bylaws are up for a vote. The bylaws committee worked very hard to propose changes to that was approved by the board, so now it's going forward at the business meeting for a vote. So hopefully you can attend that. It's also where new members in positions officially take their positions. But again, we're hoping you'll be able to attend your October meetings so that you can start to learn about your role a little bit. The November conference, and we have that in the slide coming up as well, but it's November 3rd. Hopefully you can attend that. It's going to be for 6CE, and the topic for it is our theme for the year. There is no healthcare without nurses, but then we're tagging on all nurses are leaders. So it's a phenomenal agenda for the day. You can register now for early bird until September 30th, and hopefully you can attend that. It's really going to be a great conference. The leadership retreat is December 1st, and all of you are invited. We hope you can attend. We're working on the agenda for that right now, and it already looks phenomenal, where we're going to bring forward information to continue to look at our strategic plan and how we can continue to meet that, but then also professional development as KNA leaders. So hopefully you can attend. It's about half a day. I cannot remember the time off of my top of my head. I want to say like 10 to 2, but it's about half a day. Also, mark your calendars for Nurses Day at the Capitol. We were in person this past year, and it was absolutely phenomenal. And so it's going to be February 8th next year. And the next event is for the Legislative and Advocacy Conference will be on May 17th of 2024. Both of those events will be in person, and they are held by the Governmental Affairs Cabinet. Oh, good. Thank you. All right. So here's just a couple of pictorials of what we mentioned just a moment ago. So the annual conference, it really does look phenomenal. All nurses are leaders, and hopefully you can make that and attend for the day. And then, as we mentioned, or as I mentioned, as far as awards, I hope you'll be thinking of colleagues that you work with that you think are absolutely excellent and that they're doing great work, and honor them. So put forward their names for consideration for one of the awards. We have Nurse of the Year, Nurse Researcher of the Year, DEI Nurse of the Year, Student of the Year, Citizen of the Year, and Volunteer of the Year. So for your nurse colleagues, as well as citizens and students that are non-nurses, please think about how you can nominate them. Are we going to September 30th? Okay, is that why you have your hand up? I was chatting and just looked up to you, and there you are. We are extending the nomination process for that. The applications are online. As Delanor mentioned, that little magnifying glass, all you have to do is put awards in there, and it will take you to the application. So please consider your colleagues that you can nominate to honor them. And then next slide, please. Thank you. All right. So Linda did a great job talking about Nightingale tributes and Honor a Nurse. Those are two of the wonderful programs provided by the Kentucky Nurses Foundation. And then the Nightingale tributes go out into all of the chapters. All of the elected chapters are providing this service in their chapter area. It truly is a phenomenal way to honor nurses that pass. And then honor a nurse, remember a nurse. That is another way that you can honor nurses that you know. So whether someone's done something wonderful and you want to honor them for that, or you know a nurse that has passed and you want to donate in their honor, you can certainly do that on the website. And then Kentucky Nurses Helping Nurses. This is a phenomenal project that was started back when the pandemic first started, and we realized is that, as always, nurses work so hard to take care of everybody else, but we need to take care of ourselves too. So this is a phenomenal program that we have. So if nurses are needing assistance, they need someone to talk to, they're needing some help with their resiliency, this is a program where we have nurse volunteers from across the state to assist them. So please share that program with your colleagues as well. KNA raffle. We have that right here. Linda also mentioned that a little bit ago, and Delanor helped that is the fundraiser to where we can bring money in to give it away through research and scholarships and education. So please be sure to get on the raffle. There's so many great prizes right now to get started, including the Split-a-Pot, but more are added throughout the time of the raffle. So please check back pretty frequently. There might be something new that you have to get a ticket for. And then something else that I wanted to tell you about is our t-shirts. So please be sure to get on the website. We have that beautiful heather blue. It's really soft material t-shirt. That's where it started. And it's in short sleeve and long sleeve. And then now we have white in short sleeve and long sleeve. And it has our theme on it, which is, as you know, there is no healthcare without nurses.
There you go, Julie. Look at Julie.
You got it on?
Yep, Julie, back it up just a little. There you go. That's it.
I love it. Thank you, Julie. But they're really phenomenal t-shirts to wear. And then this last slide here, again, it has that slide, Kentucky Nurses Helping Nurses, but this is just a little bit in review of how the KNA supported nurses through the pandemic when it first started, right? And we didn't have PPE. We partnered to get the face shields and pass those out. We worked to put ribbons up to let nurses know that we absolutely support everything that's being done. Hand sanitizer, signs up thanking nurses. So, we do so much together. It's phenomenal. All right, I see a hand up. Yeah. Kathy, what you got?
I just want to make sure, can you hear me?
Yes.
I just want to make sure that everybody doesn't only think they can self-nominate, but that if you know a spectacular nurse, even if she isn't or he isn't a KNA member, we can recruit them. We want them to serve in different positions. And it's just wonderful to me to know that I don't know everybody on this call. There was a time when it was the same 10 or the same 20 people, and that is no longer true, and it's wonderful. So if you know somebody good at what they do, whether they're at the staff level, leadership level, administrative level, educator role, we want them. And if you know them, please send their name and we'll talk to them. Our nominating committee will talk to them. Thank you.
Thank you for adding that, Kathy. That was beautiful. Okay. Anything else? Did anybody have any questions or anything? Otherwise, we're wrapping it up right on time.
Right on time. I just want to encourage everyone to attend the October meeting of your cabinet board or committee. It's going to be phenomenally wonderful. I know that because I go to all the meetings, as many as I can, and I enjoy them so much. The people are incredible, and the work that is being done is for the nurses of Kentucky. So please try to make it to the October meeting and learn as much as you can.
I agree. It's inspiring. It's pretty phenomenal. All right. Thank you, everybody, for being here tonight. We will see you out and about at your meetings. Take care.
Thanks, everybody.
Bye-bye.